Urinary incontinence. Don't pee your pants, because it's not very fun. What's going on, Secoya Nation? Dr. Schilling bringing you today's wellness wisdom, and today we're talking about urinary incontinence because it is a serious problem for a lot of people. Whether you're sneezing, coughing, laughing, jumping, trampolining, running, urinary incontinence can happen. It's a real deal. So for any of you that are stricken by it, here's some information as far as the background brain-body connection and what might be contributing to your incontinence other than other physical attributes that could be. Won't get into that. So Constance came in. She's one of many participants we work with. Dr. Jess works with people with incontinence. I work with people with incontinence and stuff like that. So helping understand like what the disconnect is with your body. Okay. So if you don't know what urinary incontinence is, you probably are not going to be interested in this video. But if you are, feel free to tune in. If you didn't get to see our video yesterday about urinary tract infections, UTIs, definitely check that out. Tune back in because that's a very powerful one for a lot of ladies. All you ladies out there that struggle with it, men occasionally, but mostly ladies. So when you feel, Emma, disconnected from your sexuality, that is one reason why you have urinary incontinence. Emma said hi to everybody. Give it a wave. But just like the bladder and the urinary tract, the incontinence is a matter of like your body saying, you know, I can't mark my territory. I want to mark my territory. So it allows a little bit of urine to escape your urethra because your pelvic floor, which is a little diaphragm in your body, has to tighten up or relax, and something gets to sneak out. So that's your brain's way of saying, I need to mark my territory. It could be because you feel like your position in the birth order, that's another thing relevant for this. You know, you have an older sibling you can't assert yourself and mark your territory with. And this can be, you know, thinking of Constance's older siblings, right? They were very stern and not kind and did not treat her well. This would be a perfect example for her because understanding how you fit in the pecking order and how you feel like you can assert yourself in the rest of your life. Like if you're bullied at home, you're way more likely to be bullied outside of the home, you know. Love my brother, but, you know, he beat the crap out of me as a kid. He's 6 years older than me, so that's what boys do, right? They beat the crap out of each other. And so I ended up getting bullied in middle school and then someone in high school because I was one of the bigger kids. So kids in high school decided I was a good target. So if you're having trouble with bullying, talk to your local administrator. But no, so you can, if you have a separation conflict with your mom, that's another reason why you might be experiencing some incontinence. So if you need to reach out and connect with your mom. If you're feeling like you're struggling with that, that could be a contributing factor because if you're separated from someone, it could be anybody, but mom's is a particular one for that. When you think about kids and incontinence, you're thinking about a child, when a child doesn't feel protected by their parents. Now, I have a lovely 6.5-year-old who loves to run rambunctiously and play all day long without stopping, and sometimes she gets a little dribbling, but it's not incontinence, it's more like she does not want to stop playing to go to the bathroom. Being scared in incontinence is a different story. Like if there's a domineering parent that the child wets themselves or tickles, if you will, when they're afraid or is in not feeling protected by the parent, that's another contributing factor. If you don't know which territory is yours anymore, you don't know where you fit in, you don't know, like, am I me, where do I stop and they start, and stuff like that, you don't know how to demarcate your territory, that's another reason why you might be contributing to incontinence. And if you're feeling, let's say, guilty and isolated, if you're a child who doesn't feel special, that can also cause children to have incontinence. When you think of kids in the incontinence at night, think about adrenals. So for any of you parents out there that kids, they're not feeling protected, or maybe you can help them feel more protected, remind them that they're safe, loved, and protected. So at nighttime is about adrenals, so get some homeopathic. I use with my kids homeopathics all the time. So like Desbio's adrenal support is really great for homeopathic support for the adrenals. It's not going to activate them one way or another. It helps balance them out. So yeah, that's all the fun stuff. So if you are interested in learning more about what we do, feel free to check our website, check out the other videos. I try to do at least 4 a week to keep you in the loop and touch on subjects that are important to you and help you understand like how you can relate your body to your life and how your life is encroaching on how your body functions and things like that. So If you're looking for your brain-body connection and want to get better at that, just start studying German medicine, listen to these videos, and check back with the UTIs yesterday if you want more information on that. Okay? Otherwise, we'll sign off for now, and we'll see you next week for the for the Wellness Wisdom. All right, guys. Bye-bye.